When you think of hip pain, you usually think of middle-aged adults or older, but children can suffer from this too. Hip dysplasia can be debilitating and lead to chronic pain and arthritis. Now doctors have a new way to keep young athletes in the game.
Shay Stone is at the top of her game.
The game is so fast-paced, and that's what I love about it.
Perfecting her shot since 6th grade, and now her dream of playing lacrosse for the University of Oregon is coming true.
This hat we got on my visit when we first went out there.
But Shay was almost sidelined when her hip started hurting.
It was a deep stabbing pain, like in the groin area of my hip, and I could barely put weight on it.
Shay was diagnosed with hip dysplasia, which happens when the socket doesn't fully cover the top of the thigh bone.
We have too shallow of a socket, where the hip is not as rock solid stable as it should be.
Shay also suffered from a labral tear, where the cartilage is pulled away from the bone. Hip preservation specialists were able to combine 2 procedures into one. First, arthroscopic surgery addresses soft tissue damage. This minimally invasive technique allows for repair of the labrum and removal of bone spurs causing impingement.
We go in and we take care of all the stuff from a soft tissue standpoint in the joints.
Then surgeons tackle the misshapen hip socket by cutting and repositioning the hip socket to improve its fit within the thigh bone.
80 to 90% of these patients never get another surgery.
As for Shay, recovery took 6 months, and now she's back out on the playing field, a true force to be reckoned with.
The condition is more common in females. Firstborns also have a higher risk.